Hello everyone, welcome to the Desert Stories. Today we are at Hayat International Hospital with Dr Asma Jabeen Mir. She is a gynecologist here in Hayat International Hospital. Thank you ma'am for your time. Can you tell us something about yourself ma'am?
Yeah, myself Dr Asma. I'm from India, Kashmir part, and thank you for having me here. Since I have joined Al Hayat in Muscat, I have been coming across with so many problems which we see in beautiful ladies, but yes, PCOD is such one problem which I have seen many of the young women, middle-aged women, they are coming with this complaint and the problems which they are facing because of the PCOD.
So basically you keep meeting the women who is having a PCOD more here.
Yeah, I have seen that in younger age group and the people who are in the middle age group who are struggling to have a pregnancy. So they are suffering from this problem.
Okay, so how you can define this PCOD? What exactly is PCOD? Can you please explain to our viewers?
Yeah, PCOD is an endocrine disorder in which the women will be presented with, most of the patients, they are obese, overweight, and because of that only they are suffering from this problem. They will be presenting with the features of irregular periods. Their periods will not be regular, and sometimes they don't even get periods at all, and they will be suffering from infertility, that is they are not able to conceive easily, and the presentation will include the acne on their face and abnormal hair growth because of the hyperandrogenism. So it's quite a complex disorder.
So how common it is ma'am, and how do you diagnose it?
Coming about the common, it is quite common in South Asian women, and overall the 10 to 18% of women all over the world have been suffering from this. There are certain diagnostic criteria, and we are following the Rotterdam's criteria. That is nothing but we have 3 points in that, and if 2 points are present, we will be diagnosing women as polycystic ovarian disease.
Okay.
The first, we check with the ultrasound. There is a typical appearance of ovaries on ultrasound, which we call as polycystic appearance. And secondly, her features, what the patient is coming up with. She'll be having like menstrual problems, as I said, the periods will not be regular, they'll be having problems with that, and they'll be having abnormal hair growth on their face and acne. And third one is we do the lab test or clinically picture of hyperandrogenism. So out of 3, if 2 are present, we'll be diagnosing patient with polycystic ovarian disease.
Okay, so what are the other problems which are related to it?
Since it is an endocrine disorder, so there are other endocrine problems which are associated with it, like the thyroid disorders are there, the hyperprolactinemia, and yes, diabetes is associated with this, and chronic problems like hypertension, cardiovascular disorders. So patient is always at risk of ischemic heart disease, and because of the hyperestrogenic state, that is an hormonal imbalance, the patient is at risk of endometrial cancer, that is the cancer of the womb. So these are all the problems patient can face with.
So that means once you have a PCOD, you have a full basket of other
diseases.
We
have to look
as well
for other things as well. Yes.
Okay, okay. And what are the what causes? How it happens? Like what are the causes of this PCOD?
Yeah, basically it is the lack of exercise which is the main culprit, and because of which there is more abdominal fat, and that abdominal fat leads to insulin resistance. That is the basic cause of the PCOD. Other than that, there are studies still going on that the genetic factor is also there, but it's not very conclusive. And sometimes there is family history, their mother, their sisters, their cousins, they are all suffering with the PCOD. So there is some inherited component also.
Do you think today's lifestyle is also a one which add on to the cause of this PCOD?
Because most of the women, they are working, they are so much indulged in their work and home activities, they are not able to take out the time for their regular exercise and the diet. Most of the people, they don't have time to cook at home, they go outside and just eat other junk food. So that is the main reason why people are getting obese, and because of the obesity they are getting this problem.
So doctor, how you treat such people, how you treat such patients?
Coming to the treatment part, we need to make lifestyle modifications which includes the diet plan as well as the exercise. Exercise includes their brisk walk, jogging, cycling, swimming, and the diet should be rich in high fiber diet, and it should be high in proteins. The carbs they have to avoid, which includes the sugary drinks, the refined, the processed food, it has to be avoided. So some of the patients, they don't respond to the lifestyle changes. We need to add hormonal treatment to them. And if there is a concern of pregnancy, they want to conceive, then we need to add the fertility treatment for them. So these are all modalities. Some of the times the patient is very obese, they are not able to lose weight, they can go for bariatric surgeries as well.
So ma'am, do they need to follow up after the treatment?
Yes, they need to follow, because they are at risk of ischemic heart disease, endometrial cancer, diabetes. So they need to proper follow up with the doctor, so that the doctor can advise the blood sugars for the screening, and lipid profile, blood pressure has to be checked annually, and their BMI should be under control. So they need a proper follow with the doctor.
Okay, so one last question. What advice you want to give to the Desert Story viewers, and how they can keep themselves healthy?
I will advise to please improve your lifestyle changes, add a diet plan and regular exercise to your lifestyle, and please come and visit us at Al Hayat if there is concern of fertility or any other risk factors. We will help you out. Thank you so much.
Thank you, ma'am.